What does real change in healthcare actually look like? In the final episode of this series, we continue our conversation with community health worker Joslyn Mikeworth, focusing on growth, accountability, and what it takes to build better systems for frontline staff. From lessons learned in difficult environments to the importance of communication, leadership, and self-advocacy, Joslyn shares what meaningful support can look like and how healthcare organizations can move forward in a more sustainable, human-centered way.
From your perspective, what can leadership do to better support and empower frontline workers?
Listening to your staff when they have concerns, usually it's like for a reason. As a manager, you don't always see exactly what happens on the front line. Like, I know a lot of managers try and they try and get out there and just see what's going on, but you have your job to do as well. Like, you can't always be there to see everything that's happening. So when frontline staff brings something to your concern, like it's smart to take it serious. When I was working at a hospital, we were extremely short-staffed to the point where I was on a unit by myself. I was fresh out of nursing school, like my CNA classes. I had 22 patients by myself and I was run ragged. And I was, like I said, I was still learning and I was just so lost. And I felt like the managers did not really listen to me when I brought it to their attention that not only is that not safe for our patients, it's not safe for me. And it's not manageable. And when we don't have enough nurses as it is, and then we go and take that a step further and we don't have enough CNAs, it's just you're asking for someone to get hurt and you're asking for someone to be burnt out. And it's not fun to be in that position. Like, one time I was on a neuro PCU unit, and because of my experiences working neuro PCU, I will never do it again. If you work neuro PCU, you have to be a special kind of person. It was just chaos. Like, in room 1, we had a lady who's in 4-point soft restraints, who kept managing to pull her IV out. And she was altered mental status, and it was chaos. Like, there was blood everywhere, and she was trying to bite me. And we had like 4 or 5 nurses in there trying to hold her down while she was in restraints to get another IV in. And her nurse was nowhere to be found and was like, "Oh, I have to go give this person their meds." And we're like, "We need help in here." Like, I'm kind of like holding the patient's head because she's trying to bite me. Then, like, in the next door, I have a patient with C. diff, and he's pooping everywhere, like on the bed, on the floor, just everywhere. And then next room, I have another altered mental status patient. He's in 2-point restraints and keeps stripping off and throwing himself off the bed. So he's like hanging off the bed with his restraints. And then the next one is another altered mental status, and he keeps getting up out of bed. So I was just up and down the hall all night, couldn't get a lot of my stuff done. And it got to the point, like, I hate crying, but it got to the point where I was just running down the hall crying because I was just struggling. And one of the other CNAs, he was amazing that night. He was just there, and every time that call bell rang, he was running with me, and we were just passing each other in the halls, running, and it was just chaos. But when I went to management, I was like, this is not safe working conditions, not only for me, but for our patients. Like, we're going to have a fall. We're going to have someone hurt themselves even more than they already are. They were like, okay, we'll work on it. And then from there, it just got progressively worse. And we were even more short-staffed. And it got to the point where staff was leaving because we were so short-staffed. They didn't feel safe working.
I think it's silly for leadership not to listen to their frontline workers, because that's where stuff is happening, and that is a very good resource for them, in my opinion. As I've been in leadership roles, I don't think I started out that way. I think I started out thinking, well, this is the way things need to be done, and that was that was kind of my focus of, kind of guiding and steering the ship. And as I went along, realized the importance of what my faculty had to say about how things were going in the classrooms and, what we needed to change, or just get together as a group and kind of talk about these are the things that are going on and brainstorm some ways that, well, we have to do this and we can't change that right now, but what are some other things we can do to be innovative or think creatively so that, in this situation, patients are getting what they need and getting the care that they need, and you're also in a situation that is, conducive to do that for your patients.
As a manager, when someone comes to you and you say you'll work on it, it helps if you give them an update, like, hey, like a couple months later, if you just leave it at that, they're gonna think, oh, like they don't care. But when you're like, hey, I want you to know, like, I'm working on this and like I'm really trying, that makes all of the difference. Like, as a frontline worker, oh, she listened to me. She saw what was going on and she understands that I don't feel safe working in that condition.
Are there any tools or resources that you have now at your fingertips that make it easier to do your job?
Honestly, I use Teams a lot, and that's how I reach out to all my population health coworkers. And when we have like group chats and stuff, that makes all the difference because when I have a question, I just put it in the group chat and someone always answers. When I was working like in the hospital, we had our Voceras. So that was very helpful as well because I mean when you're in a room with a patient that's like something's happening, you can just hit the button and call who you need to call.
Communication channels, like that's a thing.
Yes.
Make it easy for your staff to communicate with each other. That's definitely a thing. Any other resources that you can think of that make it easier for you to do what you do?
I mean, we have a shares drive, which is really helpful because they put a lot of like our resources in it, at least for the population health team. So every month we have like a theme. Like this month is American Heart Month, so we're focusing on heart health. They have a file in our shares drive for resources. So like flyers from the American Heart Association and stuff like that makes all the difference in my job. And just kind of having those resources all in one spot makes it so easy.
We've tried to do that for our health centers as well with our learning management system. We have a couple resource depots, and we're thinking about combining them all into one so that it is that easy one-stop shop if they need a certain tutorial or, FAQ sheet or something like that, that it's all in just one central location that they can go to, care gap reports or, whatever, so that they have access to that easily.
We have a Zara as well, which is so helpful because that's where I get my patient visit reports. I get my transition of cares, which is like our hospital, people that need hospital follow-ups, our all of our gap lists. I like if I need something, I can go find it in a Zara.
What are you finding with just out of curiosity, the patients that are in our diabetes education program? Are you seeing the needle move on A1C control?
Yeah, so I think our average right now is, I don't remember. I think it's like it's smaller, but we also just kind of started this. It's at like 0.2% decrease, 0.28% like of change in their A1Cs.
Awesome. And we have what, a dozen or so?
Yeah, we have 13 right now.
13. Yeah. Yeah. That's awesome that we're seeing a little bit of movement there. That's super exciting.
It is exciting. And a lot of the patients don't have updated A1Cs. So I think once I can finally get them in and have them get their A1C done, it'll it will for sure change a little bit.
Are there any other lessons, just in regards to the pilot, that you think other health centers should pay attention to?
No, honestly, I think it's just a great resource. I mean, working with it firsthand, just watching the patients actually take in the information and the difference of just when they come in first to when they leave last is crazy. Like every patient that has completed it has told me like that was extremely helpful. That like I learned a lot and it made a difference in just how I'm going to manage this and how I'm thinking about it as well.
That's awesome. That's what I'm hearing with the exit interviews as well. So I am thrilled that we can add this additional support for our patients. Our goal by April is to have 6 or 8 additional programs, both in English and Spanish. So, hypertension, healthy eating, asthma, heart health, prenatal, childcare, or parenting, I guess, is what it will be, and maybe another one or two that I can't think of off the top of my head, but we want to continue growing our patient education offerings, to support more of our patients and to support our FQHCs as well in the patient education space. So, thank you so much for helping us with that and helping your patients with that. It's really amazing the work that you're doing.
Thank you for letting me be a part of it. It's been amazing just seeing like the difference it makes in patients and how they how they intake it. It makes a difference in that as well.
Absolutely. It's been a fantastic partnership. I'm excited to see, to continue this and see where else it goes and what else we can do. My last question for you is if you could give one piece of advice to health center leaders looking to improve patient outcomes, what would that be?
I feel like a lot of times leadership is focused on time. So when our providers are stuck to these 15-minute time slots, they really struggle with not only getting the patient the care that they need, but also patients just feel like the provider's just rushing through the appointment. And if the provider is like running late, the patient gets upset and I feel like it just causes a whole host of problems. So just allowing your providers to take that time, like a 15-minute slot is not enough. Like you come in, you get vital, and then the doctor's like, okay, what's wrong with you? And you tell the doctor, and they're like, okay, here's this. And then that's the whole conversation. Or they're like, okay, let's do labs. And then you have to make another appointment. Instead of being able to sit with the provider and kind of talk more in depth about what is going on and the provider kind of being able to figure it out, I feel like it's just rushed.
Yeah, I feel that as a patient as well. If I could change one thing about our healthcare system currently today, it would be that we, remove those time constraints for our providers. I recognize the fee for service model is what we are focused on, but with VB Care and ABC Network, value-based care is it's our jam. And I think that's what we're talking about here is more of a shift towards value-based care and not so much fee for service mentality. Yeah. I want that to change too. I'm right there with you.
It's been great working with you guys. You guys have been very supportive and especially you, Rhiannon. Like you're always like, let me know if you need anything. And every time I message you, you're right on top of it with the answer. And it's been a really cool experience being able to work with you guys and work on this diabetic education pilot. It's really been awesome.
I agree. Thank you for your support as well. It goes both ways, you know? Like that's I feel so blessed to be able to get to do what we're doing. I know it's a tumultuous time in the healthcare space, and just to be able to feel like I'm helping make a difference in our patients' lives and in our FQHC's lives, that means a lot to me. So
Yeah, it's been great.
Over these 3 episodes, we've heard directly from the front lines with Joslyn Mikeworth. And one thing is clear, healthcare systems are only as strong as the people working within them. From the realities of patient care in rural communities to the challenges of workplace culture and the importance of speaking up, this series has highlighted both the struggles and the opportunities for change. But it's also shown that progress is possible through better communication, stronger leadership, and a commitment to listening to the people doing the work every day. A big thank you to Joslyn Mikeworth for sharing her story, her perspective, and her voice. And thank you for listening to The Exam Room. If this series resonated with you, be sure to subscribe and share it with others working to strengthen healthcare from the inside out. Until next time.